Imagine waking up one morning and your ankles are so swollen that your favorite shoes, the ones you've had for years, the ones that used to fit perfectly, won't even slide onto your feet anymore. You press your finger into the puffed skin above your ankle, and the indentation stays there for several seconds before slowly filling back in. You've been cutting back on salt. You've been taking the little white pill your doctor prescribed. You've been propping your feet up on a pillow every night before you fall asleep. And yet, every single morning, you wake up and the swelling is right back where it was, sometimes even worse than the day before. This is the daily reality for millions of people over the age of 60. And the most frustrating part? In a vast majority of cases, everything they're doing to fix the problem is aimed at the wrong system entirely. Not the wrong disease, the wrong system. Here's something that rarely gets explained in a doctor's office during a 10-minute appointment. Most chronic ankle and lower leg swelling in older adults has very little to do with the heart and very little to do with the kidneys. Those organs get the blame because they're the ones most visibly associated with fluid regulation in the body. But the real culprit, the system that's actually failing to do its job, is the lymphatic system. And because the solution for a lymphatic problem is fundamentally different from the solution for a cardiac or renal problem, millions of people end up spending years treating a condition with tools that were never designed for what they actually have. Understanding this distinction is the first step toward genuine, lasting change. So let's talk about what the lymphatic system actually is, why it starts struggling after 60, and what you can do about it, starting tonight if you want. Your cardiovascular system has a powerful, tireless pump at its center. Your heart beats somewhere between 60 and 80 times every single minute, forcing blood through a closed network of vessels under continuous pressure. That pressure is what moves the fluid. The system is self-sustaining in a very real sense. As long as the heart is beating, blood is circulating. Your lymphatic system works on an entirely different principle. There is no pump. Not a small one, not a backup one, no pump at all. The lymphatic network, which runs parallel to your blood vessels throughout your entire body, moves its fluid, a pale, protein-rich liquid called lymph, through a combination of skeletal muscle contractions, the pressure changes caused by breathing, and the natural movement of your body throughout the day. When you walk, your calf muscles squeeze. When you breathe deeply, your diaphragm creates pressure shifts inside your chest cavity. These forces, working together, push lymph upward through a series of one-way valves toward the lymph nodes, where waste is filtered out and eventually into the bloodstream, where the fluid is recycled. Think of your blood vessels as a pressurized city water main, constantly driven by mechanical force. Now think of your lymphatic vessels as an open drainage canal. The canal doesn't move water on its own. It depends entirely on the slope of the land, the flow of outside forces, gravity working in the right direction, and maintenance to keep the channels clear. When those external forces stop, the canal stagnates. That's precisely what begins to happen in your 60s. Two specific changes occur in the lymphatic system with age that conspire to create that familiar, frustrating pattern of evening swelling. First, the walls of the lymphatic vessels lose elasticity. They become slightly stiffer, slightly less responsive to the pressure waves generated by muscle movement. Second, and this is the change that matters most, the tiny one-way valves inside those vessels begin to weaken and slow. In a young, healthy lymphatic vessel, these valves snap shut firmly and quickly after each surge of fluid passes through, preventing any backflow. By your late 60s, many of those valves are sluggish. Some barely close at all. The result is exactly what you'd expect from a drainage system with slow, failing valves, backflow, pooling, and accumulation in the lowest point of the body. Your ankles, your feet, the thick, heavy flesh of your lower legs by the end of the day. That's also why the swelling almost always follows such a predictable pattern. It's at its best first thing in the morning, after you've been lying flat all night and gravity has been working in your favor, gently allowing fluid to drift upward and drain toward the lymph nodes in your groin and abdomen. The moment you stand up and stay still, sitting at the kitchen table, standing at the counter making coffee, riding in the car, gravity begins pulling that fluid back downward. Within 30 minutes of being upright and relatively motionless, you're already rebuilding the problem you spent all night reducing. Now, a word about diuretics, the water pills that so many people are prescribed for swelling. These medications are not wrong across the board. For someone with genuine heart failure or significant kidney disease, they can be genuinely important and even life-saving, but they work on your blood. They signal your kidneys to pull more fluid out of your bloodstream and push it into your bladder for elimination. That's a specific, targeted mechanism, and it works beautifully on fluid that's inside your blood vessels. The fluid that's making your ankles swell is not inside your blood vessels. It has leaked out into the soft tissue, into the fat layer, just beneath the skin, into the spaces between muscle fibers, into the connective fascia surrounding your joints. That fluid is beyond the reach of your kidneys. Diuretics cannot touch it. You can take water pills every day for months, and the fluid in your soft tissue will simply refill from the surrounding tissue and blood plasma because the underlying drainage mechanism, the lymphatic system, still isn't doing its job. The solution is movement. Specifically, the right movement performed at the right times in the right sequence. And here is where sequence matters enormously, because getting the order wrong doesn't just reduce the benefit. In some situations, it can actually make swelling worse, not better. Before your feet touch the floor in the morning, while you're still lying flat in bed, you have a brief and valuable window. Your lymphatic system has been slowly draining overnight. The fluid levels in your ankles are at their daily low. The moment you stand up, gravity immediately begins working against you. So the goal is to activate your lymphatic pump before that happens, to get fluid moving upward before you ask your body to fight gravity all day long. Lying flat on your back, flex your feet. Pull your toes toward your shins as firmly as is comfortable. You should feel a strong contraction along the back of your lower leg. Then point them away. Flex and point, flex and point. Do this 30 times. Each repetition contracts your calf muscles, which squeeze the lymphatic vessels running through them and push fluid upward toward the groin lymph nodes. This is not a new idea. It's the same ankle pump exercise used in hospitals to prevent post-surgical fluid accumulation and reduce the risk of blood clots in patients who can't yet walk. The mechanism is well established. Movement is your pump, and 30 repetitions takes less than a minute. Immediately after, before coffee, before breakfast, drink a full glass of warm water. The reason for warm rather than cold is not just comfort. Lymphatic fluid has a consistency something like thin syrup when you're well hydrated. When you're even mildly dehydrated, which is extremely common in older adults, because the sensation of thirst genuinely diminishes with age, a biological change that almost nobody warns you about, that fluid becomes noticeably more viscous, slower moving, harder to push through the narrow lymphatic channels. Warm water, taken first thing, begins to rehydrate the lymph before you stand up and start your day. That's 2 minutes of effort in the morning before you've even gotten out of bed. Throughout the day, the single most important thing you can do is interrupt prolonged stillness. After approximately 30 minutes of sitting with your legs down, at a table, in a car, in a chair in front of the television, the pressure of your body weight compresses the lymphatic vessels running through the back of your thighs. The channels that should be ferrying fluid upward from your lower legs are being gently pinched closed. Fluid begins accumulating again. Every 30 minutes of uninterrupted sitting is essentially resetting the problem that your morning routine worked to prevent. The reset doesn't require going to a gym or changing clothes. If you're standing, rise up slowly onto the balls of your feet and lower back down 20 times. This is a calf raise, and it's one of the most effective lymphatic pump activations available to you without any equipment whatsoever. If you're seated, perform 20 ankle circles in each direction or simply repeat the flex and point motion from your morning routine. If you have 60 seconds to spare, stand up and walk around the room. Walking, even slow and brief walking, activates the calf pump continuously and flushes the lower leg lymphatics with each stride. Walking is, in many ways, the single most powerful tool available for managing lymphatic sluggishness, and most of us simply aren't doing nearly enough of it. A phone timer set to vibrate every 45 minutes works well for the first few weeks. What tends to happen after 2 or 3 weeks of consistency is that you no longer need the reminder. You begin to recognize the early sensation of heaviness building in your calves, and that signal prompts you to move before you've even consciously thought about it. Your body learns what it needs and begins to ask for it directly. The evening portion of this routine is the most powerful component of the entire protocol, and it comes with one critical timing rule that most people get wrong when they first discover it. Do not begin the evening routine sooner than 90 minutes after your last meal. After eating, your digestive system draws significant blood flow to the gut. The lymphatic vessels inside your abdomen are actively processing digested fats. The deep breathing pattern that makes the evening routine so effective, which changes pressure gradients inside your abdominal and chest cavities, competes directly with that digestive process if you begin too soon. You'll experience reduced benefit at best, and some people experience genuine discomfort or nausea. 90 minutes after your last meal. That's the threshold. Find a wall in your home. Lie on your back with your body positioned close to the baseboard, and extend both legs straight up along the wall so your body forms a rough right angle. If your flexibility doesn't allow, a full 90 degrees, 60 or 70 degrees is still highly effective. The goal is simply to get your feet above the level of your heart so that gravity begins pulling fluid downward from your ankles toward your pelvis. Within the first 3 to 4 minutes, you will likely feel the pressure and heaviness in your lower legs begin to ease. That sensation is real and immediate. It's passive, gravity-assisted lymphatic drainage working in real time. While your legs are elevated, shift your attention to how you're breathing. Place one hand gently on your abdomen. As you inhale, your belly should rise and expand outward. As you exhale, it should fall. Your chest should remain relatively still throughout. This is diaphragmatic breathing, belly breathing, and its relevance to lymphatic drainage is profound and almost never discussed. Running directly through your diaphragm is your thoracic duct, the main collecting vessel for the entire lymphatic system. Every time your diaphragm contracts with a full, deep belly breath, it creates a change in pressure that actively draws lymph upward through the duct and toward the bloodstream. The exhale, the long, slow release, is when this drawing action is strongest. Breathing this way is one of the most powerful natural stimulators of whole-body lymphatic flow. And most people over 60 have shifted to shallow chest breathing as a default, partly because posture changes with age restrict the diaphragm's full range of motion. This small, quiet change, spending 15 minutes each evening breathing slowly and deeply from the belly, addresses a contributor to chronic swelling that almost no one ever identifies. Breathe in for a count of 4. Breathe out for a count of 6. The extended exhale is what activates the thoracic duct most fully. Keep the rhythm slow and deliberate, without forcing or straining. If you're comfortable adding one more element, use your palms to very gently stroke your calves during this time, always moving upward from ankle toward knee and from knee toward the inner thigh. Never stroke downward. Downward pressure pushes fluid back toward the feet, directly opposing the direction you want it to travel. Long, light, upward strokes. You're not working out tension, you're gently guiding fluid along the path it needs to take. Think of it as encouraging, not forcing. That's 15 minutes of lying still, breathing slowly, with your legs elevated against the wall. For many people, it becomes the most relaxing part of their day, and it's actively therapeutic at the same time. What you eat and drink every day either supports or undermines all of this physical effort. The first nutritional factor to understand is that the sodium most damaging to your lymphatic health is usually not the salt you consciously add at the table. It's the sodium embedded in processed and packaged foods, preserved meats, canned soups, commercial sauces, breakfast cereals, packaged bread, ready-made dressings. These foods routinely contain between 300 and nearly 1,000 milligrams of sodium per serving, often in foods you would never think to question. Sodium binds water in your tissues, and that retained water is the load your already sluggish lymphatic system must work to clear. Reducing your exposure to hidden sodium by choosing whole, unprocessed ingredients more often, and checking labels on anything that comes in a package takes a meaningful burden off the system you're trying to rehabilitate. The second factor is consistent hydration throughout the day, rather than large amounts all at once. Your lymphatic fluid becomes more viscous and slower moving when you're even mildly dehydrated, and mild dehydration is extremely common in older adults for the biological reason already mentioned. The thirst response weakens with age. A simple practical gauge: your urine should be pale yellow throughout most of the day. Not colorless, not dark, pale yellow. That single visual cue is more informative than any formula for counting glasses. Dark-colored berries, blueberries, blackberries, tart cherries, bilberries contain concentrated flavonoid compounds that research suggests help maintain the structural integrity of lymphatic vessel walls and the valve tissues within them. Think of these compounds as long-term structural maintenance for the drainage channels themselves. A small daily portion, perhaps a loose handful, provides meaningful support over weeks and months. Frozen varieties are nutritionally equivalent to fresh and work just as well. Finally, and this is a factor almost nobody connects to ankle swelling: protein. When protein levels in the blood fall too low, a force called oncotic pressure drops. This is the osmotic pull that draws fluid from your soft tissues back into your capillaries, allowing your circulatory system to reclaim and recycle it. Without adequate oncotic pressure, fluid leaks into the tissues and stays there. Leg elevation and breathing and movement help considerably, but they cannot fully compensate for chronically insufficient protein in the diet. Eggs, fish, legumes, quality meat, and dairy, a meaningful serving at every meal, not just dinner, form the nutritional foundation that everything else rests on. Before you begin any of this, there are warning signs that require medical attention immediately. Not tomorrow, not after trying the protocol for a week. If the swelling is sudden in onset and present in only one leg, especially if that leg is also warm, painful to the touch, or visibly reddened, that is a classic presentation of deep vein thrombosis. The massage technique described above could be actively dangerous in that situation. Seek care the same day. If swelling accompanies shortness of breath, particularly if lying flat makes breathing more difficult, or if you've begun needing extra pillows to sleep comfortably, that points toward the heart, not the lymphatic system, and requires evaluation. If swelling appeared alongside rapid, unexplained weight gain within a single week, combined with cloudy or foamy urine, that pattern suggests kidney involvement and likewise requires a physician. This protocol is designed for bilateral swelling, both legs, that has developed gradually over weeks or months, follows the predictable pattern of being worse in the evening and better in the morning, and exists in an otherwise medically stable person. If any of the warning signs above apply to you, please see a doctor before beginning anything described here. For everyone else, 7 days. 30 ankle pumps before your feet touch the floor. A glass of warm water. A 30-second movement break every 45 minutes through the day. 15 minutes of legs up the wall belly breathing in the evening, 90 minutes after your last meal. Dark berries, adequate protein, reduced hidden sodium, and water throughout the day. That's the full protocol. That's roughly 20 minutes of daily effort, most of it restful, targeting the actual mechanism behind your swelling rather than chasing symptoms with tools designed for a different problem entirely. Many people begin to notice a difference by day 4 or 5. By the end of 2 weeks, the pattern often shifts considerably. The evening heaviness arrives later. The morning ankles are visibly slimmer. Shoes fit again. And that waterlogged, pressurized feeling in the lower legs, the one that's been there so long it started to feel normal, begins finally to lift